With the possibility of a global H1N1 pandemic imminent, Health Minister Khaw Boon Wan said today that Singapore will not raise its current yellow alert level. That's if there's no community spread of the virus. Mr Khaw said this on the sidelines of a health event on Thursday. While Mr Khaw said a pandemic would come as no surprise, he said the significance of an upgrade by WHO to level 6 will mean that increasingly countries can no longer play containment strategies, and that includes Singapore.
We are in containment mode. Containment means protect the borders and try to stop spreading. But once it's into level 6, I think more and more countries will have to go into what we call mitigation phase. Mitigation phase means the emphasis will then shift from stopping spreading to looking after patients who are infected. Not much different from traditionally how we deal with seasonal flu.
Under the mitigation phase, most patients will no longer be hospitalized.
We are talking about where is the risk of getting infected. Is it overseas or is it in Ang Mo Kio or Sembawang? So those are the practical. So if you say the risk is at the moment is still highest from picking up overseas, therefore border control has meaning. But the stage will reach when you're already getting it from Orchard Road and so on, and Mandai. Then border control becomes less critical.
Mr Khaw says once Singapore goes into full mitigation phase, patients will no longer be going to Tan Tock Seng Hospital but visiting their GPs to be treated.
If it turned out to be just like normal seasonal flu, I mean, how do we deal with the normal seasonal flu today? The GPs are dealing with it. You certainly need to work out SOPs. That one way today they send all the patients to 993 to Tan Tock Seng. But once if you are clearer that the flu is just like seasonal flu, and we move into mitigation phase, we probably don't need to send the patient, but we can send the swab samples, and the patients can be advised properly to go home while awaiting the test results.
In the meantime, the current containment and preventive measures are still in place. Singapore has 18 confirmed cases so far. On Wednesday, the number of H1N1 infections reported to the World Health Organization by 74 countries hit 27,737. 141 people have died so far from the virus.